My name's Claire. I'm from Melanoma Patients Australia and I'm your host this evening. And we're just going to wait a couple of minutes to allow a few other people to join us, and then we shall get started. If you're just joining us, we're just waiting just a moment for people to arrive onto the session. And I think we might just get started. So as I said, my name is Claire Kelly and I'm delighted to be your host this evening for our community webinar series, which is a partnership between Melanoma Patients Australia and Melanoma Institute Australia. Before we get started, I would just like to begin today's session with acknowledgement of the traditional of the land on which we meet. And this evening I'm on the land of the Gubbi Gubbi people. I pay my respects to elders past and present, and we also wish to extend our respect to any Aboriginal and Torres Strait Islanders people that are joining us this evening. Now, before we get started, just a few housekeeping notes. Please be mindful that this webinar is being recorded and we will make that available to you in the coming days on both the MIA and the MPA websites. Importantly, we'd really like to have a Q&A session at the end. So we invite you to submit any questions on the Q&A and we will endeavour to address those during the question and answer session at the end of the presentations. Now, please do ensure your questions are of a general nature, as we can't give personal medical information or advice in this forum. And then finally, on the housekeeping notes, please do note that there will be a brief survey that pops up on your screen at the end of the webinar, and your feedback is really important to us, so we would really appreciate it if you could please complete that survey at the end, and then we'll take that feedback on board for future webinars. So with the housekeeping and important things rules done, I'd love to invite you to our first session in our three-part webinar series brought to you by MPA and MIA. And tonight's topic is Your Melanoma Nurse, what they do and how they help. Interestingly, we don't really all know what our amazing nurses do. Now, over the next few weeks, we will explore a number of topics and we have these webinars on subsequent Tuesday evenings at the same time over the next 3 weeks. Next week, we'll be talking about understanding endocrine side effects of immunotherapy. And then on the final week, Tuesday, the 28th of July, we'll be having a session that talks to understanding sentinel node lymph node biopsies and helping you to decide. We'd really love you to join us for the rest of the series, and please note that you do need registration for each individual webinar. So you can scan this QR code and you can register there, but not now because we're going to move on with our presentation. If you would rather not use the QR code, or that's not easy for you right now because you're watching on a mobile perhaps, you can find details on the Melanoma Patients Australia website. So in order of keeping this evening smooth and seamless, I'm going to introduce our three guest speakers all now. So our first speaker this evening is Peta Holly. Peta is a registered nurse with experience in cancer nursing and clinical research and specialist expertise in ocular melanoma. She joined Melanoma Patients Australia in 2025 as the Melanoma Telehealth Nurse, and she's now MPA's Telehealth Nurse Manager. She's passionate about supportive care, patient education, and helping people to navigate their melanoma journey. Rebecca next. Rebecca Johnson is an experienced cancer nurse with postgraduate qualifications in both nursing and oncology. She's currently serving at Melanoma Institute of Australia, and she's working as the program manager for the National Melanoma Nurses program. And then our third speaker this evening is Ted Mlynarz. Ted is a melanoma patient from Middleton Grange in New South Wales, and he's a passionate community volunteer and member of the Rotary Club of Liverpool West. Ted supports humanitarian healthcare missions in Cambodia and Vietnam, and he joins us today and is to be sharing his personal experience of living with melanoma and his interactions with melanoma nurses. So with the introductions made, we are going to move on to those presentations with our incredible speakers this evening. And we're going to be starting with Peta, and then she'll hand over to Rebecca, who will hand over to Ted. Enjoy the sessions, and please remember to put any questions in the Q&A. So Peta, I'm handing over to you.
Thank you, Claire. I'll just prepare my slides. All right, just bear with me. Can you see those yet or not yet?
Can't see them just yet, Pete.
Gail, I might just get you to share slides if that's okay.
Yeah, it will be 1 second, just opening those up now. Sorry.
Okay, how's that? All right, thank you, everyone. Hopefully you can see my slides now. My name is Peta Holly, and I'm a specialist melanoma telehealth nurse with MPA Melanoma Patients Australia. And I am also the acting nurse manager at MPA currently. So tonight I'm just going to give a brief overview of our melanoma telehealth nurse service and how we support people affected by melanoma at diagnosis before meeting the treatment team across the care pathway and melanoma transitions and post-treatment. So before we begin, I would just like to acknowledge the lived experience of those affected by melanoma, including with rare subtypes, whose experiences shape this presentation this evening. Their insights help us understand where support is needed most and keeps our service grounded in what matters to patients and their support people. Our vision within our new strategic plan is a nation where no one affected by melanoma walks alone. Our purpose is to support, connect and advocate for Australians affected by melanoma. Those three words describe the heart of our service, and which is practical support, meaningful connection and advocacy that reflects real patient need. Next slide, thanks. Melanoma Patients Australia provides free specialist melanoma telehealth nursing and community support programs. We are patient-founded, patient-informed and funded as melanoma specialist support service provider through the Australian Cancer Nurse Navigation Program. We support Australians affected by any stage and any type of melanoma. Next slide, thanks.
Hold on a minute, Peter. Can you just hear me? Can you just bear with us? Because I think we've lost your slides.
No problem.
I apologise to everybody that if you're having a noise problems and you can't see the slides. I think that our host in the background is just helping us to get those started again. And Could I just ask Peter that you just give us a notification when you'd like us to move those slides on?
Can you guys see that now?
Yeah, thanks, Gail. We're up to acknowledgement, but I think we need to go forward one, please.
Okay, thank you.
Just slide 5, thanks, Gail.
Slide 5.
Yes, please.
And just
Service included. Just checking.
lovely.
That's great. So this slide
Okay,
just provides, thanks, Gail, a brief overview of some of the services provided by Melanoma Patients Australia, including our recently launched regional and remote hub, which can be found on our website. And this was funded by a Cancer Australia grant, Bridging the Great Melanoma Divide. Next slide, thanks, Gail. Melanoma care is becoming increasingly complex with the emergence of new treatment approaches, and we see many patients experience emotional distress, information overload, and gaps in coordinated support. So supportive care research evidence and our own experience delivering nurse-led telehealth support shows that not everyone receives support when they need it most. So acknowledge that supportive care needs change and are often greatest during those melanoma care transition periods within the pathway. First service provides personalised, emotional and informational practical support which can help patients and their support people navigate, make sense of their care and navigate complex health systems and services. And importantly, support comes when they feel they need it most. So by working collaboratively with the treatment teams and other support organisations and providing a link to nurse counselling and peer support programs, our nurse-led telehealth care improves continuity, reduces distress and enhances people's overall melanoma experience. Next slide, thanks, Gail. So this slide illustrates how a hospital melanoma or cancer nurse and a melanoma specialist telehealth nurse contribute to the same overall goal, which is ensuring that people affected by melanoma receive timely, coordinated and person-centred support. So we share a common foundation of specialist melanoma nursing knowledge, understanding treatments and their impact, undertaking holistic assessment, providing education, coordinating care and supporting patients through often complex decisions and experiences. Next slide, thanks. A new model of care has been designed by a National Manager of Innovation, Evaluation and Impact, Claire Kelly, in collaboration with the nursing team at MPA. It's designed to reach people at key transition points in the melanoma care pathway through diagnosis, treatment planning, active treatment, treatment completion, recurrence or advanced disease and early bereavement. At each point, we acknowledge that the supportive care needs can change and it's our role to flex with the person's support needs, identify what matters most at that time and provide support that complements their clinical care. Next slide, thanks. This slide here sets out our navigation framework and the different entry points that people may use to reach the service. Important thing to understand is that there is no single narrow door into MPA services. So people reach us in a range of different ways. They may connect with us independently, directly. They may be referred by a GP or a primary care nurse, specialist melanoma nurse or a cancer coordinator nurse, and any other healthcare professional really can refer a patient into our service. So all referrals come through either our website referral form or via the National Support Line, which is now covered by an oncology nurse navigator from 9 till 5 p.m. Australian Eastern Standard Time, Monday to Friday, and there is an answering service over the weekends and out of hours. The Nurse Navigator provides foundational nursing support through an initial assessment and screening process, and then they can provide support and information throughout during that interaction as well. But importantly, they are responsible for triaging calls and referrals through to our specialist melanoma telehealth nurse, nurse counselling and peer support programs if required. So whatever path someone takes to find us, they arrive at the same warm, coordinated point of support. Next slide, thanks. So patients often contact us because they just need time and space to process what's happening at that moment in the melanoma care pathway. They may have forgotten what was discussed, be unsure what questions to ask of the care team, feel unclear about who to call at certain times, or just need support preparing for their next appointment. So our role is to clarify, support self-advocacy, and help people feel less alone between these clinical encounters. Next slide, thanks. I just thought I'd share some examples of what shared supportive care may look like in practice. So we work alongside the treating team by clarifying information that may have already been provided by them, identifying concerns, supporting patients to prepare for appointments, and with their consent, also helping connect back with the clinical team when further clarification may be required or escalation of care needs is required. So we also help fill supportive care gaps that can exist for priority populations, particularly where isolation or complexity of care may be greater. So this may include people living in regional, rural, remote communities, and when support needs for rare subtypes of melanoma, and also where support needs may fall outside of routine clinical encounters. So we can refer patients internally for additional emotional support through our nurse counselling service. And this service really provides an opportunity for acknowledgement and validation of the melanoma experience. It could be for navigating fear of cancer recurrence, anxiety around waiting for tests or surgery, navigating altered body image, and just a few examples that come to mind. So we find that nurse counselling also provides people often with their first experience of talking therapy, and which they may have never experienced prior to their melanoma diagnosis. So shared care in this context is about connection, making sure people are not alone or left to navigate uncertainty between their appointments. Next slide, thanks. The first consultation with a specialist melanoma nurse is usually scheduled for up to an hour, but that's tailored to the person's needs and comfort level. So we start by asking what matters most at that moment. And the nurse may gather a brief clinical history, explore immediate concerns, identify what those priority support care needs are at that time, and then move on to develop practical goals to support these care needs in conjunction with the patient or the support person. Follow-up appointments are then usually scheduled for 30-minute consultations, and that provides an opportunity to check in on the goals that were set out to support the patient or the support person in the first consult, and it's also providing an opportunity to check in on whether there's any new priority concerns that have developed since the last consult. Most consults are offered via telephone or web link, but we find at this point that most people are choosing to have a telephone consult. A personalised initial care plan and assessment document is then developed and shared with those receiving the specialist melanoma nurse support, and this can be shared with their healthcare team, if appropriate, and with their consent. A discharge summary is then also prepared and will be shared at the completion of a specialist support period of care, and can be again shared with the specialist team or the GP as requested. Patients may re-engage with the service at any time if new support needs arise, or during a future transition period within the melanoma care pathway. Next slide, thanks. We now use a platform called GoShare, which extends a consultation by giving patients trusted melanoma-specific resources that they can revisit and review at a later date. The resources are shared via text message and email, so they can be forwarded and shared with patient support networks as well. So we find this is especially helpful when people are feeling quite overwhelmed. They may live in a rural, remote area, or need information in a format that supports different learning styles and health literacy needs. So we share information in written, video, and even podcast format sometimes. Next slide, thanks. So we're now also collecting patient-reported experience measures, otherwise known as PREMs, at the end of a transitional care period across the foundational, comprehensive specialist nurse and counselling telehealth pathways, because we believe that patient experience is central to the care we provide. The PREMs help us understand where people felt heard, where they felt lost, and where care gaps remain in care. So that feedback becomes part of our evidence base, and it will help us improve the service, demonstrate why it matters, and help us to continue to shape support around real patient need. Next slide, thanks. So as we wrap up the first presentation, I'd just like to share some feedback from people who have accessed our melanoma telehealth nurse service. Their experience really reminds us why supportive care matters, and the difference that that connection, information, and personalised support can make throughout the melanoma care pathway. So as we close on this presentation, I'd just like to leave you with a few key takeaway messages. We know that melanoma affects more than physical health, and supportive care needs can arise at really any stage of that care pathway. So please don't be afraid to reach out to your healthcare team about what and ask what additional support services may be available, as we know seeking help is an important part of your care. We know the right support, the right time can make a real difference, and by working together with your clinical team, we can help ensure that no one affected by melanoma walks alone. Next slide, thanks. So if you are a person affected by melanoma or a health professional, you can contact MPA through the National Support Line or online referral pathway on our website. And we welcome self-referrals, healthcare professional referrals for any stage and any type of melanoma. Next slide, thanks. Thank you, and I hope this presentation this evening has provided a better understanding of how our specialist melanoma telehealth nursing support can complement the care provided by your treating team. And so I'd just like to hand over now to our next presenter, Rebecca Johnson, and I look forward to hearing and speaking with you all again in our Q&A session later this evening. Thank you.
Thank you, Peter. We're just moving straight over onto Rebecca's presentation, and we're just a reminder to pop your questions in the Q&A tab if you have any, please.
Thanks, Claire and Peter, and I'm hoping you can see my slides.
Perfect. Thank you,
clearly. Rebecca. Perfect. Thank you so much. So thanks, Peter, for that really clear and helpful overview about the telehealth nursing service provided through MPA. And I've been asked to speak about the hospital-based nurse and what nurses can do as part of melanoma care in the hospital. I'm going to preface this talk with the fact that obviously every hospital is very different, and exactly what the nurses do in those hospitals is also very different. So I'll give you a fairly general overview about what you may or may not expect from that hospital rather than the specifics, and finish with a reminder to ask your local teams about what exact care is provided locally. So my name is Rebecca Johnson. I work at Melanoma Institute Australia and have been leading the National Melanoma Nurses program through MIA for the last couple of years now. Just trying to work out how to go to the next slide. So who's looking after you? What are they doing in the hospital? Hopefully, by the end of this short presentation, I'll give you a little bit of an idea about the breadth of hospital-based nursing roles, a little bit of an idea about the coordinating team and the nurse's role in coordinating those treatments, and a little overview about the specialist melanoma nurse. So if I ask you to think of a hospital-based nurse, I'm sure that everyone will think of or recall a time that a nurse has been part of your care team. That could be quite varied. It might be maybe someone who's involved in detecting skin lesions, maybe assessing your health, assisting in surgery, managing drains or wound complications, preparing or administering treatments, counselling, helping you make informed decisions, coordinating care between the different teams. Nurses play an extensive role in melanoma treatment and can be categorized, I guess, across three broad groups, maybe nurses in primary care or early detection, in dermatology, maybe those involved in diagnosis. We've got nurses working in surgery, in pre-admissions, in theatres, recovery or post-op wound management, and those in medical oncology or infusion suites who manage the systemic therapies and their side effects. And these are genuinely very different nursing roles with very different skill sets and based in different parts of the hospital. Depending on where you receive your treatment and what type of treatment you need, you may meet one or many of these different types of nurses throughout your treatment course. And they all play a very different but very important role. Between all of the different settings of care, there is much information to be communicated, complications to be identified, decisions to be made, and care to be escalated. And that coordination between teams is very important. And sometimes it's up to you or a family member to keep track of these appointments, to ask the right questions, chase results yourself, and lead that coordination. Sometimes coordination is medically led. Maybe your GP or your specialist is starting to help pull that information together. In other services, and I'd say most hospital services, a general oncology or a surgical nurse takes on this coordination role alongside their other role or other duties, which might be caring for people with multiple different types of cancer. And in some services, select services, a specialist melanoma nurse is part of that care team, sharing the coordination work directly with you and the treating team. And in every one of these models, you and your family are the most important part of care. The question is simply who's helping you coordinate that with you. Notably, just because there is a nurse working within your service doesn't necessarily mean you need their care or assistance at that point in time. And as Peter mentioned, it's about providing the right support at the right time. I will just also flag that the Cancer Council navigation service through Cancer Connect online or on the phone, or the MPA telenursing services Peter described are always available and accessible. And so the specialist melanoma nurse is an advanced practice nurse, so a registered nurse with specialist training who's employed to provide expert care specifically to melanoma patients as part of your care team. These nurses are employed at approximately 50 hospitals across Australia, and not everywhere has one or needs a specialist melanoma nurse. So the next couple of slides, I'll talk about the role particularly of the specialist melanoma nurse or the cancer care coordinator. The cancer care coordinator is that position of general oncology or surgery who helps covering multiple tumour streams often. These positions, a recent study found that there was 89 different position titles for specialist cancer nurses within hospitals across Australia. So I won't try and call them their specific name. Every hospital calls this something different. So these nurses do things that you might see and things that you might not see that are behind the scenes. Firstly, they provide personalised education about your disease and treatment that is tailored to you. They help you make informed decisions about your care, and they help provide that coordinated multidisciplinary care so that your nurse is working alongside you and your oncologist surgical and oncology teams. However, they do many things behind the scenes that you might not see. The invisible part of the role is important. It enables early referral to other health professionals, often before a small issue becomes a bigger one. Behind the scenes, they are a streamlined contact person for early escalation of clinical issues for both yourself and the treating team. And they enable early assessment, management, and intervention for treatment side effects through close monitoring that you may never see. And so what does this mean for you as you come into a hospital? Is that a specialist melanoma nurse is an expert nurse who's working to keep you safe and well. Cancer care coordinators are connecting you with the treating team. But most importantly, if you are receiving hospital-based care, it's important to ask what support is available for you. We encourage you to utilise supports from the MPA Nurse Telehealth service or Cancer Council navigation to enable you to receive treatment that's navigated and coordinated with confidence. Thank you. I'm going to stop sharing there now, and we've got Ted here to share his story.
Thank you, Rebecca. That was wonderful. And we'll be handing over to Ted. And I think Gail is going to be sharing some slides for us. Over to you, Ted.
Thank you. Good evening, everybody. My story with melanoma started early last year. There was a small lump started to appear on the side of my neck just below the ear. So I went to the doctor. He sent me for an ultrasound, and the report came back. It was the report came back an enlarged lymph node. Doctor said, go home. The lymph node usually does swell occasionally, so let's just monitor it and see what happens. About 3 weeks later, the lump was about the size of a table tennis ball. So it was off to have a biopsy and scans, and both of them confirmed a metastatic malignant melanoma involving the parotid gland. From there, they referred me to the cancer centre at Westmead Hospital, and my treatment started. In the meantime, just after the treatment started, just after the first visit to the Westmead Hospital, I was doing some fundraising for the Rotary Club I belong to, and I slipped on a wet pavement, dislocated my ankle and broke a bone in it. So that was another thing to worry about. However, from then on, it was regular CT and PET scans. They commenced on a 3-monthly basis with immunotherapy every 3 weeks for about 8 sessions, and then every 6 weeks for the final 3 sessions. From then on, it was just visiting both the surgeon and the specialist at the Westmead Cancer Centre and monitoring the condition. Finally, the surgeon said we'd better get in and cut out your parotid gland because that's where the cancer is. And I underwent surgery on the 26th of June, 1925. From then on, I just moved on. If I could have the next slide, please. I kept getting treatment, and finally, around about May this year, the immunotherapy stopped, and the scans well, proved negative. And the hospital decided that I didn't need any more treatment. However, that they would monitor me. And again, they haven't told me for how long the monitoring is going to take place. But it could be for a while, and I'll have to I'll do blood tests as well as the scans till they are sure that everything's okay with me. On one occasion, visiting the surgeon, I became emotional, and he decided that he'd call the melanoma nurses and asked them to give me a call, which they did. And I had a couple of sessions over the phone with them. They helped me out. I suppose it was I was speaking to someone who understood what I was going through. Talking with friends, and especially my friends at the Rotary Club, it's fine, and they cared, and they were concerned. They didn't know what to say. I found it easier to discuss my concerns with the melanoma specialists who understood what I was going through. I live alone, and that made the conversations a lot more important, and I suppose calmed me down a fair bit. As it says there, it helped to feel heard, reassured, and less isolated. Next one, please. This is what I do today. With the Rotary Club, I'm involved with two organisations. One does free cataract operations in Cambodia and Vietnam, and the other one does cervical cancer screening and treatment and HPV vaccinations for young girls aged between 9 and 15, where the government in both these patients usually come from isolated rural areas, and the governments in either country just don't go out that far or that out there to provide the vaccinations. So I was there in May this year, and we vaccinated over 400 young girls in about 10 days, which was very pleasing. As you can see there's my fundraising efforts. The person beside me is an ophthalmologist from Melbourne. I've known him for about 17 years, and he came up to be part of the fundraising. The middle photo, my job with the cataract theatre is to sterilise the instruments, and we do anywhere between 400 and 500 cataract operations, free cataract operations in a week. And on the right-hand photo is this was in Cambodia, a district called Kampong Chenang, where there's a floating village, and we go out and visit and help the people with medical aid and humanitarian food parcels. At the moment, I'm also, about 3.5 years ago, I was diagnosed with prostate cancer, had the prostate removed, and I'm being monitored there for, it's usually for about 5 years. So I've had 3 years of all clear testing, and I've got two more to go. That's usually done in December. So that's pleasing to see that the cancer's not coming back. And it's the same with the melanoma. There is nothing. As I was talking to Natalie and she put together a bit of a paper for me. However, one of the things that I said to her, I did not feel fear while uh, when I was diagnosed with the cancer, or even while I was being treated. I trusted all the medical staff and the people that were looking after me to do the right thing. And at the moment, everything is going well. So that's basically my story. And if anybody has any questions, your time is coming up shortly. So thank you.
Thank you so much, Ted, for such a personal and insightful presentation. I think it's very powerful for all of us, whether we're here as patients or family members or nurses equally and health professionals. And we really appreciate you sharing your story with such authenticity. I'd also like to suggest that you might add an extra image on the end of your volunteering as a volunteer speaker at Melanoma Webinars, which is a new string you can add to your volunteering. But we're very, very thankful to you for sharing, and of course to all the other speakers as well. And thank you to Holly and to Rachel and to you, Ted. And so with that, we will we'll go into sharing, having some Q&A time, and I'm just going to see if I can get the Q&A slide back up, and if I can't, I'll get Gail to stick it up. Let me just check that you can see that okay. Can you see the Q&A slide okay? Yeah.
Yep.
And can I ask our speakers to put their cameras and mics back on, please? Thank you. Well, I hope that everybody found that those sessions enjoyable. I certainly did. And we do have some questions, and hopefully our speakers can be prepared to answer those questions, which I will fire towards each of you now. I'm going to actually start with asking Ted a question, if that's okay, Ted. Ted, you mentioned that you spoke to the nurse at Melanoma Patients Australia, the telehealth nurse. Did you also have a specialist melanoma nurse in the hospital you were at? And when did you meet that nurse?
I met her on my the first time I went into the cancer centre.
Yeah.
She actually worked very closely with the specialist, and she just took care of everything for me. Made all my appointments, made sure I had all the correct referrals, blood tests, as well as the scans, organised the scans with the people that do them, and yes, she looked after me.
Great. So you were one of the patients that was able to access both hospital melanoma nurse and the MPA melanoma nurse, and that's been beneficial for you to have the support of both. And they both, would you find they complemented, you know, and had different roles that were complementary?
Well, the nurse at the hospital, she mainly managed my case and made sure that everything needed to be done got done, made all the arrangements for everything I needed to do. And the melanoma nurse, she mainly spoke to me, as I mentioned earlier, just to get my story and for me to get things off my chest so that I could just keep going.
Sure. Thank you so much. Okay, I'm going to ask a question here from one of our people attending. Again, I'm going to come to Ted just while you're on a roll. Ted, did you consider joining an Melanoma Patients Australia support group, a peer support group, where you could connect with other people with an experience of melanoma?
It was mentioned to me. However, I didn't really feel like I needed to do that. As I said, I've been living on my own for a long time, and I'm able to look after myself.
Yeah. Okay.
It's just that the melanoma diagnosis scared me a bit.
Of course, absolutely. Thank you for that. And on a similar vein, I think this one's probably for Peter. What proportion of melanoma patients who approach the Melanoma Patient Australia telehealth nurse also would like to engage with a support group?
Yeah, that's a great question, Claire. I don't have an exact percentage, but through our Oncology Navigator service now, that the option for peer support programs is offered to every patient that connects with our service. We then revisit that supportive care options throughout our consultations. We know, as I mentioned, sometimes it's the time might not be right in that first consult. So it's a matter of just introducing that to someone so they know what's available, and then revisiting that support option down the track. Some people find it's too raw initially at that initial diagnostic time, but as they transition through their care pathway, it can be certainly something that that they revisit and find right at that time. Yeah.
Okay, thank you so much. I have another question, which is, and I can answer this, I don't need to fire this to anybody. So somebody's asked, is the MPA telehealth service free? And yes, it is absolutely free. There is no cost for any of the Melanoma Patients Australia services. So we do encourage you to get in contact if we can help you. Peter, do you know whether that's a highly used, is the melanoma service highly used by people from regional support? Does that provide an extra layer of support for people living in regional and rural Australia?
Yeah, absolutely. And Claire, we find obviously that people living in those regions feel quite isolated and sometimes just need additional support in terms of what practical supports are available, whether it be transport or even we also find that they're probably sometimes a little less reluctant to call in if they've got concerns, if they are connected to a tertiary metropolitan cancer centre. So we find often that we can encourage patients who might be sitting with a side effect or worrying whether they should call in, encourage them to reach out. So that's an area that I feel we do offer a lot of support in.
Okay, thank you for that. Another few questions. This one is not come up on here, but it was one that was sent earlier. You mentioned, Rebecca, and I think it's an important point. You mentioned, I guess, two things. I'll come to the second one as a separate question, but you mentioned that people that maybe were looking for support could either contact the Cancer Council Navigation Service or the Melanoma Patient Australia Telehealth Nurse Service. Can either you or perhaps Peter, maybe you both can talk to this, help patients to understand which one when and what's the difference?
I'm happy to, I guess, to start. So sometimes we find that patients will call the Cancer Navigation Service just because they're aware of that service and haven't heard of us before. So, but then what we find is they will then refer Cancer Navigation Service will then refer into MPA as a specialist support service. Likewise, if a patient does navigate themselves to us first or is referred to MPA first, there will be certain supportive care services that we can't provide individually. So if someone is residing in a different state, we might refer into their state-specific cancer support or go through the Cancer Navigation Service. We'll then link them in with their state-based cancer council service. And we do that because we know that they are aware of all the services that are specific to that patient's residence area. They also offer a lot of peer support programs as well, telephone support programs that we don't currently offer. So yeah, they're a link to other community services that are out there in the cancer sector.
Okay. And I think probably to add to that, MPA obviously provides that excellent melanoma specific information. But Cancer Council and that program provides general cancer information. And so they can provide a lot of detailed information about things that aren't necessarily specific to melanoma, but really important for cancer generally in terms of, some of those accesses, exercise and diet, and nutrition, and broad and general information, particularly in written format, that are very accessible.
Yeah. Yeah, and it could be transport to treatment within their patient's local area. And we just can't be across everything. So we recognise the importance of linking back into that service where needed.
Okay, so between what we're saying is understanding, it's helpful if we explain what the difference is between those services, but a patient then, I think what I'm hearing is a patient could potentially access some of the MPA services, the support from the hospital melanoma nurse and the support from Cancer Council Navigation Service, depending on, and they could be having support from all of those three services.
Exactly, and can contact one and be referred to the others as needed, but can contact any as the kind of appropriate way to get that first initial support. And there's no right way to get that initial support.
Okay, so bringing together what Ted said about Ted was referred to MPA from, I think he said your nurse or your doctor, Ted, that referred to
a doctor.
So your doctor referred you to Melanoma Patients Australia nurse, and that's wonderful to know that happened. And we know that Rebecca and Peter potentially could refer patients to one another, and that system works. We have a question here from somebody who says, and I find this is difficult to read. I have just completed 5 years of hard yakka with stage 4 metastatic melanoma. I had no idea what this service provided. And I think you're talking about, this is referring to MPA. Can I still access support even though I am not in treatment? I am NED, no evidence of disease, but still unwell. Peter, can you talk to that?
Yeah, I'm happy to take that one, Claire. Thank you. It's a great question. I think our model of care has been designed for patients to be aware that they can access our telehealth support service at any stage of the melanoma care pathway, which does include post-treatment. So absolutely, we find that is actually a time point in a patient's care pathway where support needs can often increase as the clinical encounters decrease in frequency. But, it really does change patients' trajectory moving forward, adjustment to life post-treatment, side effects related to treatment. We know that's ongoing, and it is a major adjustment period. So we're absolutely there for patients during that period.
Okay, so the answer to the question about can I still access support even though I'm not in treatment is an absolute yes. And we encourage anybody with melanoma who needs some support. Rebecca, you did mention in your presentation that, and I think it's great advice for patients to ask what support is available. But how do people know what support they need when they ask that question? Are we asking when we say what support is available? Do you think that patients, I guess if we encourage patients to ask, is there a specialist nurse or a nurse that can support me? But if there isn't, how do we advocate for patients to get the support they need? Is there anything we can do there?
Tough question. It's such a hard question, and I think one of the greatest challenges is, and Ted, maybe you can speak to this, but when you get, I imagine when you get diagnosed with something, you don't know what you don't know. You don't know what you need. It's an overwhelming period of time, and it's hard to know what to ask for when you don't know what there is to receive or what's expected of you and what to expect coming forward. And so I think, you know, that is a really challenging question. I think it's important to ask in your treating team, you know, is there a nurse part of my treating team, and what is their role? You know, what can they do for me? How can they help me? That's probably a really important question to be asking with so much variation around the country.
Yeah.
I think the next, you know, piece from that is, if there's not a nurse in my treating team, you know, what are the pathways for me to get information? Who is able to provide assistance to me? Who do I report side effects to? All of those are kind of important questions to be asking of the team. And I think, you know, if there's not a nurse within the team, that's a really important place where I think MPA and Cancer Council can provide that advice as to what questions to be asking to provide, you know, to help you make informed decisions, but also have meaningful conversations with your treating team to get the support you do need.
Yeah, great. That's fantastic. And I think that is an important, you know, role that certainly is provided by MPA, is having somebody to help to form those questions before somebody has an appointment, particularly with a specialist, or, you know, what are the right questions to ask around different areas and around decision support. Now, I'm going to ask this last question because we've got 1 minute, and I think it's a simple yes or no. It might not be. This question, I'm not sure if this is okay to ask, but am I allowed to ask for a buzzer at my next CT scan, like they give you, put in your hand when you have an MRI?
You can always ask. You're allowed to ask anything, is what I say.
Yeah,
I agree. Yeah.
I think that's a great question, Claire, and it just goes to, it's a good example of no question is a silly question, and I think that's often something that we do emphasise with patients that connect with us.
Yeah, absolutely. Well, it's just clicked 8 o'clock. I'm just going to ask if any of our, I'm going to firstly thank our incredible speakers for their time this evening. And I'm also going to thank everybody that's contributed and attended this evening, just to thank you for your time. We know it's a busy time, or a relaxing time typically, not a time to be getting into the detail of melanoma, but we really appreciate everybody that has come along and attended this session today. I'd also like to just remind you of the sessions next week. The session next week on endocrine disorders after immunotherapy. And I'd like to just offer any final comments, closing comments from our speakers before we say goodbye, and also a reminder to complete the survey. But before we just close, is there anything specific that any of you would like to say as closing summary to the end of the evening that you didn't say that perhaps you would like to say? No. No. Well, with that said, well, with not that said, but with deepest thanks to Ted, to Rebecca, and to Peter, and as I've mentioned, to everybody for sharing this evening with us, and for all of you for sharing your insights. Thank you to those who asked us questions. We really find it valuable to help us to do our work going forward, understanding what your queries are and what your questions are. And just a reminder again to please complete the survey, which will pop up at the very end once we come out of the webinar. We'd really welcome your feedback on this evening's webinar, and thank you for attending our first. I apologise for any glitches and any problems with the sound. We'll work on getting that smoother next week, and I'd like to wish you all a lovely evening for what's left of it, and thank you again. We'll see you next week.